And then the last piece here around a successful program that we're seeing, and Dr. McCord touched on a couple of these as well during that conversation. It's not just about getting 500 or 1,000 or 2,000 patients enrolled in these programs, right off the get-go, and then hoping that they stay engaged. It is incredibly important and difficult to have your patients remain in the program and active. And Medsien has over a 95% retention rate across all of our partners, and all those patients that are enrolled across all of our partners, all those practices that we work with, over a 95% retention rate, which we're very proud of. And we're doing that through a couple areas that you see here. We have that dedicated staff, right? Those folks that are dedicated to your patients. We're able to scale that team when necessary for your practice to 10, 20, 30 or more care managers, depending upon the number of patients that are being enrolled. So you're always going to have that staff available to be dedicated to your patients. And it's also quite a burden to try and do that internally, to manage those many folks on your end. So things that you don't have to worry about, but are necessities in terms of a successful program here. And then on the infrastructure side, again, that integration that we have software-wise, not just for the automated billing process and taking away any of that manual reconciliation, but knowing every time that Dr. McCord looks at one of these dashboards, he sees exactly what he needs to see. He sees those correct vitals coming from the RPM program. And then again, it allows for his patients to have a seamless experience with these programs. And like you said, they kind of forgot about it because it was so seamless every year until that deductible or something comes around in January. So these are really key to what we see being really critical to have these successful and sustained programs at scale and maintaining those scale for those programs throughout the partnership with the practice.